According to the CDC, on average, every minute someone dies from a heart attack. And it's no wonder when symptoms like indigestion might confuse someone to what's really going on. So to get us jump start on Heart Month, I headed out to Bedford Memorial Hospital to not only brush up on heart attack symptoms, but to also find out what happens when you go to the hospital to be tested for a possible heart attack. Registered nurse Sybil Calhoun tells us more.
Typically, for men, when they come in, they will have pain in the chest, sometimes in the jaw area, and they'll complain that there's like an elephant sitting on their chest. There's a lot of pressure. Women have a little different symptoms. Sometimes they will complain of indigestion or jaw pain or pain in their shoulder blades, which is a little atypical. But
that's so strange, too. I mean, that's so scary because it could be so vague. You know, how do you know? You know, better safe than sorry?
Yes. A lot of times if patients have these symptoms, they need to come in and be checked regardless. If it turns out to be nothing, great. If it's something, then it can be taken care of immediately.
And you just gave a good example to me earlier about somebody that went out to eat and was really sure that it was just indigestion from the restaurant.
Mm-hmm. We had a patient that had complained. They went to a restaurant and they were having indigestion, thought they had food poisoning, and it turned out to be actually their heart. They came in to have a nuclear test done and ended up being shipped out to the cath lab before it was all said and done.
And really, if somebody comes in here, you guys can take care of the process, right? We're actually in the nuclear lab right now. If somebody's coming in, they think they have a heart attack, this is one of their first stops, right?
Yes. After they're in the emergency room, they're going to, most of the time, order a nuclear test to check and see if they're getting circulation where they need to in their heart.
And we actually have a mock patient right here, and he's going to be part of this process. And what is happening to him here?
Well, when they come down to have a nuclear test done, they're put in the chair and they will have one set of images done. Then they will go to the treadmill room and have walk on the treadmill. They'll be injected with some more medication and then come back for one last set of pictures. The test is read on the same day, and from the pictures up there you can tell that if it looks like a full donut, the heart's fine. If there's any piece missing from that, then that's an area of the heart that's not getting the circulation it needs to get.
And we're going to move on and find out more information on what would happen if you think you have a heart attack and where would you go next.
Okay.
And we were just in the nuclear stress lab, and now we're actually looking at a patient's heart here. Tell us a little bit about this process.
Okay, this is an echocardiogram that's being performed. And many times when a patient will come into the emergency room with complaints of chest pain and lots of symptoms, the physician will order an echocardiogram. This test looks at the walls of the heart to make sure they're all moving like they should. It also looks for congestive heart failure and to make sure that the valves are working like they're supposed to.
And this is fascinating technology, and you have the staff here all the time that can take care of this, don't you?
That's correct. Yes, 5 days a week.
Excellent. Now, what's the next step in the process?
Once they have the echocardiogram done, if there's any problems with the valves or the walls of the heart, typically they will be shipped to either Lynchburg or Roanoke to have surgery done. And then once that's done, they will come back in for cardiac rehab.
Now, Sybil, the idea now is to build back the strength of the heart, isn't it?
Yes, it is. Once surgery's been done, then the doctor will refer the patient to come back for cardiac rehab. The surgery will include bypass surgery, stents, valve surgery, and they will be in cardiac rehab for 6 to 12 weeks, 3 times a week, building the heart muscle and the body muscle back up.
And I would assume you have to change your diet and you have to change your lifestyle after this, wouldn't you?
You do. We have nutritionists that will help with a low-fat diet. Also, we put the exercise program into place, and then we also teach them about stress management.
And you have good lessons coming up through a fashion show about heart health. Tell us a little bit about the fashion show. It sounds like so much fun.
It is a lot of fun. We participated last year. It'll be February the 3rd from 1 to 2:30. It is free. And everyone that is in the fashion show will be giving a heart healthy tip, and it is to educate the community.
And what kind of clothing and designer kind of stuff is going on with that?
Well, I think everyone will be choosing what they're going to wear. I don't know what all will be involved with that. But you are encouraged to wear red if you come, and all of the models will be wearing some form of a red dress or red tux or whatever if it's a man.
And it's free to the community, right?
Yes, it is. It is.
What a fun way to learn about heart health. Now, you need to sign up as soon as possible for Redline Fashion Show. You can RSVP by calling Carillion at 540-266-6000. And if you want to find out more about heart health, you can call Bedford Memorial Hospital 540-586-2441.